So you might also wonder and want to know, are there any alternatives to surgery? Well, as we mentioned, the diet, exercise, lifestyle changes, keeping your mind more calm, doing yoga, meditation, all these things are going to help. And then there is medication. The usual medication which starts with tablets. If that doesn't control it for too long, your physician will give you insulin. Now you know there are newer medications available. There is Semaglutide, that's a drug that's available in a tablet form. It is being launched even in injectable forms, which you can take once a week. So these drugs also help in control of diabetes. The problem with this is that this is drugs, they are medication, this is pharmaceuticals. As you know, even the simplest medicine can cause some side effects. Even a simple paracetamol, a crocin, a Dolo has been seen to cause some severe blood reactions and great depletion of the white blood cells and can lead to a very serious situation also. So we have to remember that if we can do anything or without too much of medication, that would be the best intervention. Therefore, surgery has a role in that because it gets rid of all these things and brings you back to normalcy without any medication. Now, for those whose diabetes is not very severe, who are in the early phases, if you are overweight, we can reduce your weight by putting in a balloon in the stomach. These days you get a swallowable balloon which is like a pill. It's a capsule of this size to be swallowed with water just sitting over here in the clinic, and we can place that balloon that will help you to reduce your caloric intake, reduce your weight to a certain extent, and that is going to help you to bring your sugars under control if you're in an early stage. There are other endoscopic methods for people who don't like a balloon sitting in the stomach, because this will stay in the stomach for between 4 to 6 months usually. There are other balloons which are the older ones which are still available, which can be placed inside up to 1 year, but that requires endoscopy. It requires a short anesthesia to place it in, and then at the end of 1 year to remove it also. The swallowable ones don't require any endoscopy or anesthesia or any hospital stay. So those are the advantages. Other endoscopic methods are there where by suturing inside the stomach, we can slim down the stomach. So the stomach, when it gets slim, you automatically have a feeling of fullness, you will eat less, it is better for your weight control, it automatically brings down the sugar levels. So this is another useful method if you don't want surgery. For this endoscopy, you need a half a day or a 1 day stay in the hospital. There is a short anesthesia involved, but from the next day onwards, you can be back at your work without the feeling of fullness of the balloon, and you will have avoided surgery. So if this is what suits you, even those options are available. So we have these multiple options available. Sometimes we can have a combination of 2 or 3 of these to give you the best result. Remember that when your diabetes is significant or severe, the best thing for you actually is to do surgery to get rid of all those factors, bring you back to normalcy. Earlier stages, yes, you can do non-surgical options, but we recommend that you do something about it, do not neglect it, so that you can take care of your health and be healthy.